should have entered your BFIS account number, and you don't need to do anything else. We will take care of it from there. If you didn't do that, you can put it in the Q&A and use the Q&A function to do that. Put your name and your BFIS number. That would be great, and we can track that down that way. I also want to let you know that the format for this is the Q&A and the chat are visible to the panelists, who are Maria, who's helping us with tech, and Breena and myself. And the attendees are muted. Let's see, and lastly, there is a survey at the end, and if you're wanting a hard copy to show that you did professional development hours, you can fill out that survey, and that is the way that you would receive a certificate that way. I think those are all of my announcements. We will be posting this webinar. We're recording it, and we will post it, and we will also include the slide deck on the Let's Grow Kids COVID-19 resource page. So I'm going to turn it over to Breena at this time, and she will go through her presentation. And then many of you submitted questions. If they're not answered throughout the presentation, I have a list of those. We will look at those first, and then we will also be paying attention to the Q&A as well, and get as many in as we can. So thank you, and go for it, Breena.
Okay, hi everyone. I wanted to acknowledge that many of you, we spoke on Friday. I think there may be some or a lot of overlap, that Friday was a most unusual day. I felt that the governor's announcement, which was, a little bit of a surprise to all of us in the morning, followed by my time with some of you on Friday afternoon was, not ideal. So the content is pretty similar today, but we're going to try to really, I've heard from tons of you, and I love hearing from you, and I want you to keep the questions coming, because we don't have all the answers, but we really want the connection, and we want you to tell us what's in your head and what is what keeps coming up, because it's such a fast-moving process. So I begin with gratitude for all things that you have done in the past and are going to do in the future. I think that it's an extraordinary time. There are a lot of heroes in this response, and I consider you among the top of that list. I also know that you share my deep passion that the virus is a problem, but so is the isolation of children, and the high quality care that you provide for children is invaluable, and it needs to be balanced with what we're continuing to learn about the virus. So it's a really, really important time. So we're going to talk about the data, which is the most important part for feeling like it's time to reopen. We're going to talk about testing and contact tracing efforts so that you as community people will continue to know what's happening in your town, and will be hopefully reassured through the summer that we're continuing to contain this virus. We're going to talk about health guidance because it's coming out tomorrow, I promise. It's in several phases of review at several layers of the Agency of Human Services, but it's going out tomorrow. And then we're going to I'll throw in a few training opportunities at the end. And as Sherry said, I do have your questions, and they're threaded throughout, but I'm super hopeful that, that they'll be answered as I speak as well. Uh-oh, something just happened. Can you still hear me?
Mm-hmm. Yes.
So my screen now has the training feedback. Can you see my slides?
Yep.
Weird. Are you seeing the training feedback thing? No?
No.
No. Just, okay, what should I do? Go back, maybe?
So do you have a Zoom like downloaded onto your computer?
Have just hit. I don't know, but let me just new share. How about that? So sorry, it's just all.
Breena, can you see your slides?
No, I'm going to close out the
Okay.
training thing I must have hit. There's my slide. Okay, we're back.
Great.
And now I have to
We're
click.
always so good in practice.
We really are. Okay, so folks, just a reminder, there is one case in the state of Vermont of a child under 9 since March, one case. And super uneventful experience without revealing too much, but a mild experience in a child under 9. We do have 26 cases in people 10 to 19, but I'll tell you that over 20 of them are above the age of 15. And we've tested a lot of kids, trying to get that denominator for you, but none of them have been hospitalized and none of them have required extra care in the respiratory arena. So, I'm careful to not reveal too much of protected patient information, but I also really need you to keep track of this data with me because I think it's going to create a lot of support for you and your families in concern. Because we talked on Friday, New York State is acknowledging and describing a pediatric inflammatory syndrome that may be associated with COVID-19. And I will just tell you, because I feel like there was a lot of scientific back and forth on Friday, and I loved that. Those kids in New York are not testing positive for the virus. They're testing positive for the antibody to the virus. And as you've heard me talk about, but I can go further, the antibody test is, we don't know much about it. We don't know what it means to have antibody to this virus. We certainly don't know if what moment in time you contracted the virus. So I'm part of the CDC's national team, making a case definition for the inflammatory concern that's occurring in some children that may be associated with COVID. And the way you do that is you create a case definition. What are the criteria in the case that would make you think that it's an inflammatory syndrome? And then we'll track it in Vermont if it happens. And the health department is very good at this with our UVM colleagues. So we only have one kid under 9, and she recovered a long time ago. Okay, it's a good reminder to tell you that I think more than ever in my life, I've had to go back to groups and say, I told you something yesterday that changed today, or I told you something yesterday that I didn't describe quite correctly, and I'd like to correct it. So please bear with me and my team as we continue to stay as informed as possible, help you with your questions, but also correct ourselves with mistakes. So you got to slow the spread. We did that beautifully in Vermont. This is pandemic. This is from, public health school, but also from experiences around the world with pandemics. The flattening of the curve and all those graphs you saw a lot in March and April was done so beautifully in Vermont. I still don't even really, I can barely deep breath because we waited and waited for thousands of people to end up needing hospital care. Virus, we only had 18 people in the whole state on a ventilator. So it is a remarkable place we have found ourselves, and now we are in phase 2 clearly. And that phase 2 is because we haven't had, or now almost a month. We just have, yesterday we had no new cases, and 3 days before that we had a 0 case day. In between there were a few sporadic cases. Our hospitals were safe and ready and never got to a point of crisis. We have this ability to test and test and test, which we'll talk about. And we have active case monitoring so that every time there's a positive case, we find all the folks around that person with medium and high risk contact, and we contact trace them as well. So on the right side here, it's just a reminder that even though we're in a good phase, we still can't relax some of the paradox and the awkwardness of where we find ourselves with the care of children. So obviously, if people don't have to work, we're encouraging them to stay home, but we're asking you all to come back into the work environment. And I acknowledge that is the source of concern and needs to be talked about constantly. You're going to be wearing facial coverings. We're going to talk a lot about that. We're all going to be way I did see a lot of questions come in from you all about kids with, significant asthma, steroid dependent, folks who provide home-based care, family childcare homes that have vulnerable spouses or family members, those cases need very special consideration. And while I hate to say that children with significant should be excluded, I really think in this early phase of reopening, they should be. And I'd like to talk to you very seriously about each case. And then we need more treatment, and we're getting there. And it's the first bright spot and sign of hope in this virus is we do have some treatment. And then we'll
Breena?
talk a little bit about immunity. Yeah.
Can you,
You
you
there?
cut out a little bit when you were talking about the questions around kids with asthma and steroid treatments? And that.
Oh, gosh. Okay. So thanks for, and definitely interrupt, Sherry, if you can't hear me. That's a bummer. So what I was saying is that those folks do need special consideration, and I'm not sure they're going to be able to go into care. Can you hear me?
They need special consideration, and you're not sure they'll be able to go into care. Mm-hmm.
Yeah. Okay, I'm moving just in case it's better. Is this better? Okay.
Yeah, I can hear you.
Great. So, and that's, I mean, a really unusual thing for me to say out loud. We really don't exclude kids, and we hate any kind of notion of exclusion, but it is, it's a reality. Okay. And I
Breena,
want to talk.
Does that include asthma? People are asking.
And childhood disease, and I would encourage folks to think about asthma on a continuum, because there are tons of kids with well-controlled asthma that would not be considered vulnerable. So those, if kids have medical homes and pediatricians, those conversations need to occur, because it isn't, it's not a one-size-fits-all with that diagnosis. Okay, thanks for asking that. So we talked about this too on Friday. This is, here we go, phase 2. You know, policy decisions get made at the governor's office, not at the health department. And the size and the of the social gatherings increases with a little bit of science, but mostly just sort of best common sense. We're currently at 10 people in Vermont, as you know, which now matches what we recommended for emergency childcare. This number has to increase in order for us to open our childcare system. I'll just go on record as saying it. It isn't going to stay at 10 to do this well, and I'm not the decision maker, but I wanted to reassure you I am trying to influence this decision because the data is good. We're heading towards schools opening. We're working really hard to align childcare and summer camps to be all the same, and the guidance you see tomorrow is going to be for everybody. And then we went back to elective procedures in the outpatient setting last week. And the next step is elective surgeries in the hospital setting. And maybe you heard on Monday that retail is open to 25% capacity with all the other restrictions, including facial covering. Bars and restaurants will open soon in a different way than ever before. And then we'll get a vaccine. And I have a strange relationship with this dialogue because some scientists say it will be years, some say months, and I like to stay, I need bright spots. I'm sure you all do too. And I don't want to think this is years out, but I don't understand enough about the politics behind how science gets shared across countries and around our world. So each news source reports this differently. We did open up pediatric testing, as I described a while back. This has, you know, been a great idea, except the kids aren't that sick. So we recommended that mildly symptomatic kids be tested about 3 weeks ago. We have seen a little bit increased testing, but not as much as we would like. So as I told you, we are going to head into this space of, or maybe I haven't told you yet, but we want more and more people who don't have symptoms to get tested, mostly so we understand what's happening in Vermont. And so that may include children, because we're able to do the front of the nose now with a little Q-tip and not be subjecting kids to that tricky procedure of sticking a swab all the way to the back of their nose. So this is all part of the current testing approach. The governor really wants 1,000 tests a day. We do about 650 a day right now. So we're going into long-term care, we're testing healthcare personnel, we're going into corrections. And as you know, or I hope we've talked about, we think childcare providers should be tested if you want to. It's an opportunity. We said early on last week it was for emergency childcare providers, but this week we're saying any of you, if you want to go get a test, we're going to give you the information on these pop-up sites and you can go get a test. I just want to make sure you know that it's completely voluntary and this has nothing to do with reopening. And I'm worried that it's the conversations are happening in parallel and that you folks will think that it's somehow related. This is about just groups of people that are out and about, some exposure, and now even further, just any Vermonter to see what's going on with this virus. And what happens is it helps us pull out positive patients and say, hey, you have the virus, even though you're asymptomatic, you need to go home. But it doesn't reassure us in opening care. It's not going to make your center feel less healthy or no reassurance to it real time because it's one moment in time. So if you get a test and you're positive and you're not sick, you're going to be told to stay home for 14 days. If you get a test and it's negative, we're going to have to figure out for all of us, how often are we going to test ourselves? I mean, right now it's pretty much the sky's the limit, but for a time. And it's mostly about getting our society open and getting a lot of information. I do want to reassure you that when you test positive, there's a whole system behind you. The health department will call you and the contact tracing will occur. And if you are providing care in that setting, you will have all the help and support you need to make decisions about your classrooms.
Breena,
So pop-up, yeah, go ahead.
Answer right here. How there's questions about the accuracy of the COVID-19.
A great question. So the scientific term is the sensitivity of a test, which is how likely does it pick up the virus. And it's either 80% or 95%. And there's 7 different tests and they all span, depending on the study, between 80 and 96%, meaning that it would pick it up 80% of the time. So just to be candid, there are tons of people in March and April that doctors thought, oh my goodness, this person completely has this virus. The test came back negative. So imperfect, but the tests are getting better all the while. And it's the best we have right now. So we had a pop-up on Saturday. It was supposed to be this big event and then it snowed and it was freezing cold and we ended up testing 140 people. We were hoping, I think, for 300, but if any of you wandered on down there, I'd love to hear what the process was like for you. Today we're doing Bennington, Attleboro, and Hartford on Thursday and Saturday. And stay tuned because we're going to do 4 or 5 more next week. So coming soon to an area near you, I hope. That link is active and available. All you do is go on and sign up for a time. We are saying if you have symptoms, however, you should be tested through your healthcare provider. That's a different pathway, and it includes going to a test site that's associated with a hospital, not one of these pop-up sites. And then recognizing many of you may not have primary care, which I'd really like to help you with. I think sometimes in unusual circumstances, we can create better systems, and you are such an important workforce, and I really want you to have good health care and health insurance. So that's been a really important part of this dialogue. And the current system, if you don't have primary care, is to call 211. And they're all activated and ready for all Vermonters without primary care to have this touch point so that we can make sure people get what they need. Contact tracing, super cool. It's an epidemiologic set of well-trained people. They actually have an app that they send to the patient with the diagnosis and to all the contacts, and they ask the person through the app to track their symptoms each day while they're isolating. And it's also a good reminder, this work is hard, and it's made much harder if you, as a person who tests positive, have no idea where you were the last couple of weeks or where you traveled about or memory of which grocery store you went to. So we do have It's a little bit of extra work, but the health commissioner wants us to just keep track of our movement as citizens of Vermont, and a little notebook to remind ourselves of our movement. Okay, here comes the guidance. This little graphic is the April 5th iteration. Tomorrow's May 13th, and the new guidance will be available by link. It's super important to me that there be links and not hard copies, because the minute you print out a hard copy, I mean, certainly do that to digest the material, but hard copies then become sort of solidified as the facts, and we change this link whenever we need to as it relates to changing guidance from the CDC and others. I will tell you that from the survey that you all did for Child Development Division, there was a lot of great feedback about what materials and information you need for your families. And that we have a meeting tomorrow with Child Development Division and the Health Department to pull together what are the appendices, the links, and the documents you all need to do this well. And some of the links I love, it's like click here and print for the sign for hand washing. Click here and print for the checklist for your health screening at the front, all that sort of stuff. So the document itself will have those links, but then we also are going to have an ongoing update for the resources that you've requested. So some little small things but when people, if you do get the virus and you're going to be in close contact with the health department, you're not going to have to do this. I just thought you'd be interested that you can considered recovered from the virus if you've gone 3 days without a fever, and if you have gone 10 days since your symptoms appeared. Obviously, this is only if you found out you had the virus with symptoms. Some people have the virus without symptoms. So I also wanted you to know that retesting does not work. And we tried that for a while with our corrections officers. It turns out people are staying positive for the virus for up to 60 days after, even though they feel well and they've recovered. And that's a scientific thing about the way the little RNA, the little genetic material of the virus can still be detected on this super sensitive test. So we're not retesting people. The health check's the same, and I recognize some of you have not been doing emergency care, so we do recommend that when there's a daily health check for children attending your program and your staff, and you ask the caregivers, have you been in close contact and have you felt unwell, meaning as the child? And we added, because the CDC changed the clinical definition, now it's not just cough or fever or shortness of breath, breathing, chill, shaking, muscle pain, headache, sore throat, and this loss of taste and smell, which is common with the virus and super strange. Uh-oh. Sherry?
Yes, Breena?
Can you hear me? Oh, good.
Yeah.
So, and we want to help you with this. This is one of the many supply issues that we have your back on. You're going to need cloth facial coverings, eye protection. That's really simple. It's just protecting the more eye. It's not some massive screen or mask. And you just need a disposable pair of gloves for each kid each morning, thermometer. So that's the routine. I have colleagues who have done this very well a few months, and we're here. So you know a lot about this, that the CDC has come out with lots of guidance on how to slow the spread of this virus, and also why it's okay to use cloth, even though everything infectious disease people have been taught us for years and years is that that's not effective. Well, it turns out that because this virus spreads when we speak, it's okay to wear a cloth covering, and it's enough. And I really hope that we can make the behavior change as a society to do this for a while, because it really helps. About kids, how do I close that down?
Breena, you're cutting out again a little bit.
I'm so sorry. Should I try? Do you want me to call in on my phone and then?
Yeah,
And
I
then-
think,
Yeah.
let's try that.
Okay. That'll give me 1 sec to do that. That's all.
So while Breena's doing that, I can answer, I saw some questions in here that maybe, oh, one of the questions was around why schools aren't opening, and Secretary French addressed that last week at a press conference and talked about that schools were already closed for the school year. They're participating in distance learning and not wanting to disrupt distance learning. And in addition to that, some of our school buildings hold over 1,000 children. So bringing, those types of large groups together wouldn't make sense for a 10-day, 8-day, maybe 12-day period.
Sure, you hear me?
Yep.
Okay, so I joined by phone, but it said I was muted. Did you unmute me?
You're unmuted.
Yes, you're good.
Breena, it sounds like it might have gotten a little choppy for people when you were going over the health screening. If you wouldn't mind just going through that
Sure.
again, I think that would be helpful.
Okay. So let's see if the screen, this will go, whoops. Okay, can you hear me?
Yes.
Yeah.
And
Okay,
also-
so the health screen requires a setup and equipment. And so you start by talk about drop off and pick up. You have a space where people stop and enter individually. And we're gonna have some signage for you about that. And the caregiver is asked, has the child been in contact with someone with COVID, or has the child themselves? And then there's some specifics around the details of the virus: cough, temperature, shortness of breath, etc. And then the health screening itself is about you as the provider wearing a mask, which you're going to be doing anyway, a facial covering, eye protection, which is just glasses, nothing special, and a pair of disposable gloves for each child, and a thermometer. And you have to change your gloves for each child, and then discard the gloves. I hope you can hear me.
yes, we can.
Okay, and then we talked about cloth facial covering. So I want to talk about kids and I have talked to a lot of you about this, and I really welcome the conversation and the dialogue, because these are recommended but not required. The CDC only weighs in on kids under 2. I actually misspoke last week. I said under 3, but to me, 3 and under is sort of the no cloth covering zone, but everyone has a different opinion. But I do want to remind everyone of things you know, which is children model, they watch us, and they're noted, and they all have the developmental capacity to some degree to know that something's very unusual about our world, and it's okay to engage them in the prevention of the spread of. And I completely know kids may not come along, but I want to give them the opportunity. If they can't do it because they're touching and it's much more of an infectious risk, then let it be. And obviously, if there's a medical reason for not wearing it, let it be. But let's not assume no one can do it. My staff, as you may know, we've got 59 people in my division, and almost all of them have young children, and they're all wearing masks because, public health people are onto this. And at my staff meeting today, they showed me pictures of 5-year-olds, 8-year-olds, 7-year-olds all wearing masks. So cloth facial coverings. I keep correcting myself because the docs, the healthcare professionals want masks to be preserved for healthcare, and the cloth coverings are for the rest of us. And that's why I keep hesitating on that word. American Academy of Pediatrics has a pretty good resource for this on their healthychildren.org website. That's a good website if you're seeking sort of one-pagers. And they talk about the sort of the child development issues and also the engagement around germ prevention spread. Okay, still hearing me, I hope.
Yes.
Health guidance about drop-off and pickup falls squarely under the category of do the best you can. This comes right from the CDC. They just want staggered arrival. I think this is important because one of the general principles in public health now is groups need to stay intact. You don't want cross-pollination, that if you have a center and there are multiple groups of kids, we want each group to only be in contact with themselves. I know that's a lot of logistics. We would prefer same parent or designated person do the drop off and pickup just for that contact tracing mostly, that if a child or a staff person has the virus, that there's not multiple people that were exposed. And that vulnerable group of older adults should not be the caregivers, the dropper offers if possible. We really want hand hygiene at the front, at the entrance where kids enter. I've heard from tons of you that you don't have sinks there. If you can't route entrance to a sink first, you should have a hand hygiene station that includes hand sanitizer. Sort of obvious, but if people are quarantining, which doesn't mean they have the virus, it just means they either were exposed to someone who did, or they came from this shouldn't be happening, but came from another state or off a cruise ship. Those folks should not be doing the drop-off. Okay, so you get a confirmed case, and I really want to reassure you that we're here for you. And this might, I hope, we only had one kid under 9 since March 2nd. But if it happens, we gotcha, and we just will. This will be so easy to do. You close off the area, you air the room, you wait 24 hours, then you clean, and you disinfect, and you tell everyone that as best you can. I mean, there are some privacy issues, so you can't always say who it is. We've been very other settings that the patients themselves have called all their coworkers, said, "Oh, I got the virus." It shouldn't be stigmatized, and we shouldn't, but we also shouldn't assume that staff want to be the one that they may want to just protect that it's one classroom and not the whole center. So there's a lot of privacy issues. And then the decision of how long to close after you've had a case. So first, the decision to close is about the size and whether it was childcare. You will have to close for a few days, but if it's a center and it was one classroom, only the classroom shuts down. So we'll make those decisions with you. And then you really don't have to do any of this if it's been 7 days since the person was in the facility. And that's the part we really help you on, is get the information, and then we'll talk through, wait, so when did that person work? Or when was the last time that kid was in the environment? And a lot of times there was no exposure. And we hope this isn't a thing, but obviously reduction in your capacity to care for kids based on sick workers is an important big policy. We got to talk about that at the Child Development Division level. Okay, some of the specifics. I said this earlier, the same group of kids has to be together all day. You can't trade up and drop down to one provider at the end of the day like we like to do, or have like one person that brings in the kids from 2 different classrooms at the same time. So big logistical challenges here. We got to create space for kids that nap to be head to toe, and they have to be 6 feet apart. It's just the safest, and we got cleaning playground equipment. Some of you have asked about that ahead of time. I don't have a lot to tell you beyond what you'll see in the guidance tomorrow, because it's a little bit of common sense and a little bit of shoulder shrugging, like, what you want me to do that? So I think like toys and things out in the playground, like in a sandbox, need to be washed in between groups of kids coming. But in terms of, trying to wipe down the metal part of we're trying to be in a little bit more of a common sense space there. So see if, when the guidance comes out tomorrow, if you get sort of the general principles you need, and then please call us. You really can't have the soft toys and the dress up and the puppets that are to Santa. If kids need their attachment objects and their little loveys for transitions, that's okay, but they have to be set aside and not be part of the regular day with the interaction. And the bedding should be intuitive anyway. So the guidance also has some deep dives on more and more of how to get kids engaged with hand hygiene. I promise you there are pages and pages on cleaning and disinfecting. There's a lot of specifics about infants and toddlers. Physical distancing now, social distancing sounds like isolating and sad. So physical distancing is impossible with little kids, but also let's not assume that kids of a certain age, and you can help me with what age, want to be involved in these fun conversations about creating some space around each other to try to avoid germs, and how you can be out and about on a playground or in a classroom in pods, little micro pods. That being said, I obviously am a person who in reality, and I don't, these are recommendations. There's no, punitive action when, if we see two 2-year-olds together in a sandbox. I don't know why I keep talking about sandboxes. Maybe it's hopeful for warm weather. Prep and Niels have a lot of guidance in our what's coming out tomorrow as well. So VOSHA, which is the occupational safety group in Vermont, has a requirement that everyone that opens any kind of business in the COVID pandemic take a training. And it's just a slide deck. It's not even narrated. It's just information on a slide that's available on their website. And you just click through it and learn. It's very similar to our guide, a little broader. Okay, so here's some interesting language that we're still struggling with. You should not provide care if you're older or have chronic disease, including pregnancy. So should not versus may not, must not. I just want you to know we don't know what to do here, and we're going to have to go case by case, because these diagnoses and people over 65 are at higher risk for this virus. It's just the fact. But there is of opportunity for people to say, well, I still want to care for kids, but we just don't know how to put it all together right now. And I just wish I could tell you there was a checklist or some box you could check to say I'm 66 and I'm going to do it anyway. I don't want people to feel they have to, but I also don't want people to think that it's some exclusionary process if you have mild asthma and you're well controlled and your doctor thinks you're doing fine. So it's not a very satisfying answer, but I think we have to work on this together case by case. And then I also want to acknowledge that in family childcare homes, you may have a caregiver who's healthy, but the spouse or someone in the home is experiencing one of these chronic and needs to socially distance or physically distance, but you are, welcome to provide care. So messy. This is messy.
Breena, can you expand on that? If you're a center, like you work in a center and you live with someone that has
I saw that question.
Yeah.
I'd really like, I am a healthcare provider. I'd like to get your healthcare providers involved with that conversation, because it's not easy to put on a webinar. Well, you can work if your husband has, asthma, but you can't work if he has chronic obstructive pulmonary disease. There's mild, and higher risk conditions within all of these lists, and it's not easy to do blanket guidance. So if you're living with someone with a chronic condition, there's a risk to you working in an environment outside of the home. There's a risk. And what I'd be curious about is individual cases of what is that person doing for work themselves and exposed on their own, and then you have your exposure, and what's the risk benefit analysis from a health perspective you're going to move about this in the coming months. So it's a very unsatisfying answer, but I think it's because in an ideal world, everyone with a vulnerability would have minimal exposure. And that's why this slide is so definitive, except that in Vermont, this precludes, this takes a lot of our workforce right off the table. So, and someone asked me specifically about pregnancy, we don't know a ton about the transmission of this virus from a pregnant individual to a fetus. And so that we know something not worth the risk. So pregnancy is we're gonna heavily recommend exclusion from care. There is a required sign, which this is not the updated sign because awesome Bev Boget and Sherry Carlson at Let's Grow Kids mocked up a different sign, of attention to stopping right at the door. We're gonna get you that sign.
Yes, we are. We will get that, we will definitely have it posted as a PDF, and we're also looking at getting them printed and sent out. So we're in the process of seeing if that's a possibility. Excellent.
And then here's the crux of the whole thing. I said this earlier. Classroom size is going to be determined by data and epidemiology, and I'm doing everything I can to get you a number, ASAP, because I'm sure you can't do any of your planning without this, and I'm June 1st is really close. So just a reminder that there won't be any opportunities for these, whatever the group size is, you can't bring 2 of those groups together or expand into some different eating arrangement. Just a general reminder, people do not wash their hands for 20 seconds. It's that silly, you have to sing happy birthday twice. It's just not happening. There's all sorts of examples of people not doing it. And then the outside visitor and volunteers is super interesting, that we're starting to really want to talk about services that kids get in their care, like OT, PT, and speech. And we have a separate group working on the guidance to reopen home-based services. When kids go in for when you go into a child's home for developmental education or our home visiting programs, and those are parallel processes, but because they're in my division, we're crossing them. So with all the right protections, we are going to let OT, PT, and speech professionals and work with children if we can figure out the temperature check, the cloth facial covering, all the hand washing. But I didn't want to leave you in despair that this visitor volunteer recommendation precludes those services. You guys have been awesome at the facility questions. So currently half walls don't work you can't have like 10 kids on one side and 10 kids on the other because of the respiratory spread across a half wall. But rooms, you can imagine that world. We're not saying you have to have a door, but we are saying that you have to think about how kids move about. So you can't have everybody coming through the door at once. You have to have that pod of 10 doing something separate and staying apart. One group moves the door. It all sounds it's so important. And I just want you to know we're willing to think about your facility with you. And again, recommendations, do the best you can. And then summer is the same. So all the opening up of camps and summer programming is going to have the exact same guidance as I've described today, but we're going to have to think about like the bus that takes the kids up to go to the swimming pool. We just decided that will not be, it's too specific for the guidance of like appendices about special experiences. The guidance does address transportation, however, and it describes you can have whatever the group size and have a group on a bus or a van, but you got to wash it before, you got to wipe it down after, and then just repeat. So the supply chain is our top of our list, and we have talked to the governor, the State Emergency Operations Center, the Agency of Commerce and Community Development, which is trying to get aligned with us around the day camps and the summer programs. And we know that you can't do this without tons of supplies. And we don't, it seems like gloves and hand sanitizer are okay. We have a plan for thermometers, but you need wipes and soap and all those details. So, and what think we have a system of, and I shouldn't be the one to speak about this, but Child Development Division, has this money that's going to start flowing, but they're going to ask you in the next week to go in and say what supplies you need, how many kids you're serving, and it's all going to be perfect, right, Sherry?
I can't imagine how it couldn't be.
It's super. And then so this is just the prompt about the labor safety slide deck. It's really not going to say anything more than you've learned today, but you're welcome. You are required to go do this, and feedback to me if there's something in there that doesn't make sense. Full commitment from the public health nurses in my division. We will answer the phone and talk you through your questions. We do 8 to 3 Monday to Friday, but we have a mailbox and we check it Saturday at 1, and you have a question that comes up on the weekend that can't wait till Monday. And this ranges from like what to do about isolating a sick kid all the way up to, I just heard there might be a positive. I don't know yet. We haven't heard from the health department. Like, we've been preemptively just talking through what might happen. We're so lucky because most of the time when those stories come through, it ends up being not a positive case. But this is our commitment to you. And as I've said in other arenas, if this isn't happening, I need to know. If you're not hearing back, you're not getting good response, then there'll be a pathway that needs to be fixed.
Hey, Breena.
Yeah, go ahead.
Since you brought that up as an example, there were some questions like if a kid is not well and he's going to be tested, do you close right then, or do you wait until you find out that they're
definitely
positive?
Don't close. So there's pre-test probability, which is super helpful in this virus. I just told you there's only one kid under 9, and the population of kids under 9 in Vermont is 54,000. So that means when you have a sick kid, you don't have to do anything because it's so unlikely that test is coming back positive. Then it comes back positive and we say, okay, so now we'll figure out who was around this kid. And the best news about tests in the last month, we're getting results back in 24 hours. Like, there was this terrible time in March when it was days and days. It was all about like just building size, and so get the results and be able to have to do in the very, very rare event that it's positive. Is that helpful?
Yes, very helpful.
Okay, and I always throw in Help Me Grow, because Help Me Grow is our sort of system for aligned developmental screening and child development across our sectors, but it's also for sub families and children, and never have we needed a resource hub more than during COVID. And what I'm learning is some of the things that we all were just kind of doing, like docs were doing developmental screening of kids, they can't do when they're doing remote telemedicine visits. So Help Me Grow 211 is now doing online developmental screening for, right? So, but this is a great place to call if you have questions about a family in your care, food, mental health support. And I know you already know this, but good reminder. And then I also want to step out of the virus for a minute and just say we're all in this together, that we're worried about our kids. And this, the impact, acute phase of the pandemic, we're going to feel for months and years to come in the emotional lives of our kids. And there's just so much we can do together on the social emotional health of people that you're with every day. And I know how valuable you are as a workforce to this conversation, and I would much rather talk about this than the virus. Joke, I'm here for you to talk about this terrible time, but I'm so grateful that our kids are going to be back in these settings where they can get their needs met, and that we can start to understand the magnitude of what the impact was on and is on families. And then, I'm a strength-based person, so I know that you also will bring such a sense of hope and positivity to these families. Health department has a few resources. Website's fun. I know you don't have tons of time, but play around with the website. And then I love this thing called the chat bot, where if you have a question that's not on the FAQ in the health department, then put it in and see if they can answer it. And there's a school and childcare specific page just for you. So we're done with that. I did want to acknowledge that 2 other things you guys asked about, runny noses and just mildly symptomatic kids, they can't be in care. And I get calls from others about this as well, that they feel like that's a burden, and that folks should be allowed to be a little sick. It's just not going to work right now. And it's extraordinary time, extraordinary measure. So you're going to get pushback from these pediatricians are being kind of nudgy about this, like, oh, it's just a cold. It's not just a cold. Just stay home or get tested, right? Now that we're testing everyone, just go get tested. And then fever, you can't go back to childcare for 72 hours. That's because we're putting the guardrails on as tight as we can, and we don't want to change that. So it's not good. It's hard for families, but please know that. No sick kids, no fevers, no it's too slippery. So there's that. I think I addressed the other pieces, recognizing that the big pot of uncertainty is immunocompromise, your partners, your own health, your own age. And tried to get clarity this morning with Child Development Division, like, what do you want to say? And we just don't know, because it's risky. But a lot of what we're going to do in the next months has some risk to it. So I'm going to just leave it there and hope I have more to tell you as the weeks go on.
So Breena,
Okay,
just
thoughts.
a few clarifications, because I think you cut out when the half walls are not, they don't work.
So sorry about my technology. You can't use half walls because the respiratory particles go across, but you can do some cool things with plexiglass and with curtains that are a certain type of thickness. And so that's a little bit of I get into trouble with this because I don't understand fire codes and facilities. So within the parameter of respiratory spread, you have to have a full barrier up to the height of the adults, really. So half wall, you could have a wall that's 6 feet if you don't have any 6'2" human, you know what I'm saying? Yep. But it has to be fire code, and I don't want to get in trouble. So respiratory spread, no half wall.
And the hand sanitizing stations, is that just using hand sanitizers? Well, is there need to be wipes? What?
Well, just hand sanitizer is enough. I mean, I think some kids do better with wipes because they have more surface area, and you can go in and out and in and out, and oh, you're not seeing me, in and out and in and out and in and out with the fingers. We can show you, there's some good videos on hand washing, and you can approximate that with a wipe, but sanitizer's good enough. Some of you have asked about, there's some marketing of these cool little stations of sinks. I want to explore all this with you. I want to acknowledge that you don't have any money to do this. You're going to get these grants from CDD. We're going to buy what you need. And then if you reach the threshold, we're going to have to say, we need more money for this. Like, this is important. This would be, I want you guys to have trash cans that you can open with your foot. Because, when you do inspections of people's infectious disease handling, you wash your hands and then you turn off the faucet with the same hand. Like, that's null and void. Or then you go close the trash can with your hand. I mean, I've probably touched my face 9 times in this talk. So hand sanitizer's good enough. Mm-hmm. But if you want a little sink and somebody wants to donate that, or we can figure out a way to get it, like, I just want you to have stations.
And does it matter the temperature of the water for hand washing?
No, I mean, in perfect infectious disease spread world, it's warm water, but cold's good, soap's good.
Mm-hmm. Breena, there was a lot of conversation about runny nose, and in the previous webinars, you talked about kind of knowing your kids too, and if it's a kid.
So a couple things about that. Kid cough, the kids that have the little coughs because they've had asthma for 5 years, like, that needs a conversation with the pediatrician, but let's let those kids who are super well controlled and they've coughed since the day you met them. I think you can figure that out as a team with your kids' medical home. And then seasonal allergy comes up all the time, and I've had pretty pointed conversations with colleagues. If you know a kid has seasonal allergies and they tech and the stuffiness goes away, again, okay with me. But not you guys having to make that call. That's not, I don't want you in that position. Mm-hmm. And that's the same with like I think for a little while we have to be extremely strict about symptoms.
Right. Let's see, there was questions about, there's a lot of stress around like trying to social distance or physically distance with 0 to 5-year-olds. And just what's your best guidance around that?
I think we need to dig in a little bit more on stuff. I just know it's not easy. It's not going to happen. But I also don't want to sell it that you some stuff. And the example I have is from other countries where they do those cool, there's hula hoops and there's funny stories about Chinese kids wearing these amazing hats that had these long poles to prevent them from being within 6 feet radius. My brother lives in Hong Kong and his kids are all in these funny dialogue. One of them's 7 and one of them's 5, and they do these dialogues with each other about spinning and distancing and on the playground. So I just want to live with you in the fact that it's not doable, except please still try. Is that?
Yeah, that makes sense.
There's something there. I mean, one of my staff told me that kids draw circles in the driveway with the chalk and they think it's fun.
Oh, you froze on us. I think you froze, Breena.
I lost her.
Yep, there you are. I can hear you. A couple other things. A lot of you asked about face coverings, and so one of the things I want to mention is there's a lot of, I know some of you are talking about infants, and that's a little bit different maybe then, but there are a lot of resources out there of social stories to do with kids around the face coverings. There's a lot of good examples. Some of you may have been on the webinar that we just hosted with the 3 women that have been providing emergency care, and they had a lot of good examples of how they addressed moving to wearing face coverings in their spaces. So there are some resources out there around that. There's also, some of you have seen, if you're worried about the facial expressions for infants in particular, there are some creative solutions out there in terms of using clear materials where the mouth is, drawing on the mouth. There has been some other solutions to that have been put out there. Breena, can you hear me now? Because I had one more question.
I sure can. And I turned off my video because I was worried it was messing with connectivity. And
around families, did you say in the beginning that there is going to be some family resources?
Absolutely.
Okay.
So, and what I loved about that was, that you guys were so, you took so much time in those surveys to answer the specifics of what you need. And, we thought we were directing families toward websites and stuff, but I think we need to be more creative about how you want to share information. And I've also heard, so I did want to float an idea. I know some of you with bigger centers or maybe have boards, board directors, and I wonder too if there's some partnering we want to do with boards of director and information so that it's, there's just more comfort in that the health and safety has really been well thought through and that we have a lot of guidance. So let me know about boards, because pediatricians offer to me a lot at the community level that they would be willing to partner with you to do this messaging. So I haven't really known how to make those connections, but please let me know.
And I see people keep commenting about supplies not being available. Where am I going to get supplies? And I think I've heard you say a few times during the webinar that you're working with others at the state level on trying to solve some of that problem, as well as other partners to solve that access.
Yeah, I mean, we advocate for you at every high level meeting, and the Secretary of Human Services, they all know we're not doing this. And, I'm also you just have to tell me if this doesn't work when CDD sends out this link to say, tell us what you need. And that's supposed to be, ASAP. So.
Great. Well, thank you. So this is the end of the webinar. I do thank you for attending. Thank you, Breena. There will be, the guidance coming out, and there'll probably be some other opportunities and some more opportunities for families to connect. I also do want to also put a plug in again for the webinar that happened just ahead of this. The Let's Grow Kids hosted those 3 women. That will be posted later this week. So if you didn't participate in that, I think they had some really great information about how they implemented emergency care following all of these this guidance and guidelines, and they had some really creative solutions. So I think it will be helpful to tune into that too as you prep for opening. So, and we did record this, and we also will have this up later in the week.
And keep the questions coming. I'm learning a lot from you all. I'm grateful.
Thank you, everyone.
Bye.